Mrs. Kasuja Rose, a 43-year-old tailor, sits in a small examination room in a clinic housed in Kasenye, a chaotic Kampala slum. She was screened for cervical cancer in this room several months earlier.
I was told that when you are checked for cancer, even if you don't have it, you'll get it because of the machines or the instruments they use. So when I came to see the health care person, I asked so many questions.
The nurse described the procedure to Mrs. Kasuja, explaining that she would be screened using VIA, visual inspection with acetic acid, or the vinegar test, and that all the instruments used would be sanitized before they ever touched her.
After that, I accepted and I was tested.
Mrs. Kasuja tensed up during her screening, but as soon as she received her results during the same appointment, she relaxed. They were negative.
After the test, I felt fine. I wasn't nervous anymore. In fact, I tried to tell other people to come for a test. I told them that if you're found with cancer, the treatment is free, and if it's in the early stages, you can be treated and you heal.
Catherine Awoma is a 33-year-old police constable, the only woman on the police force in Nakasongola, a rural district of central Uganda. She lives in a small house in a village in Nakasongola with her 3 young sons. Catherine traveled to the village health center for a family planning consultation. While she was there, she learned she had several concerning symptoms.
So they told me that the blood is coming. It's not okay. You first go and check the cancer.
Catherine was referred to the district health center in Nakasongola's capital for a cervical screen. At her appointment, several precancerous lesions, which Catherine refers to as the things, were discovered on the lining of her cervix. The attending physician recommended that she receive cryotherapy, a treatment involving the application of a low-temperature probe to the cervix that freezes tissues using liquid nitrogen or carbon dioxide.
So he told me, the thing's now coming small. It's somehow small. Let me burn. We are going to burn for 3 times. So you are supposed to stay without the man. You be very far with your husband.
Side effects from her treatment include back and abdominal pain. Catherine explained that the most upsetting things she's experienced are the waves of discharge that come for days after each cryotherapy session. She says it smells badly, and she's embarrassed to see people, which leaves her feeling lonely. Her side effects also make it impossible for her to go to work at the police station, so she relies on a single cow for the income she needs to take care of her children and to pay for their school fees.
I know that one is a part of life. I supposed to need to first go and check. Because if I stayed just at home like this, the things, it will going to continue to developing. Yet for me, I'm not aware about it.
Hospice Africa Uganda has been delivering palliative care to people in Uganda and other African countries since 1993. Edisa, a 40-year-old single mother of 5, has been going there for the past year to manage HIV-related pain. Several months ago, she began experiencing discomfort in her abdomen. The staff at hospice encouraged her to go for a screening near Mulago, Uganda's national referral hospital.
When they screened me, they realized that there were 2 small holes on my cervix. So he told me, we see these 2 holes, we're going to refer you to Mulago for further screening. I went to Mulago and they screened and they found out that I had the cervical cancer.
Edisa was diagnosed with stage 2 cervical cancer. She was fearful of what the diagnosis meant for her survival, even though she qualified for surgery, given that her cancer was caught at an earlier, operable stage.
At first, I heard that once you get cancer, you never heal. But then others told us that once the surgery has happened, then the cancer doesn't spread. Because if you let it spread, then it will be difficult to operate on it. So that's why I surrendered, so that I have this surgery.
Even though Edessa was confident about the prospects of her treatment, her decision to have surgery upset her children.
They felt so bad, they were sad, they were worried that I may not make it from the theatre because I'm the father, I'm the mother, and thank God I recovered. They saw that I was wheeled out alive out of the theatre.
When it comes to cervical cancer care in Uganda, Edessa, Catherine, and Mrs. Kasuja are the exception. 80% of new cervical cancer diagnoses in the country are given to patients at the later stages of the disease, when the chances of treatment are less promising.